Welcome to another in the series Forensic Moments. I'm John Gall, a forensic physician. Today we're going to talk about bruises. Now, you probably have one, you've definitely had them in the past, but what really are they? What's the definition? Well, a bruise is an area of hemorrhage beneath the skin due to blunt trauma or by forceful pressure against a firm surface. In many cases, bruises are not particularly distinctive in their appearance and maybe just confluent type bruises, but there are some that are really quite distinctive. The first of these, as shown in this photograph, is that of petechial bruises. Now, petechial bruises are small pin-sized bruises, or about up to 3 millimeters in diameter, that generally occur on the upper part of the body and particularly on the face. And they result from an increased pressure in the blood vessels and usually occur following someone being very firmly grabbed around the neck, or can be seen in vehicle accidents or other accidents where some heavy weight has landed across somebody's chest. For example, a vehicle running over somebody's chest. And these bruises you can see on a person's forehead, on the conjunctiva of the eye, and various mucous membranes. Another bruise type is that of the imprint, and this is shown in this photograph. Imprints can take any form, and it depends upon the nature of the object that's been used to hit somebody. In this case, it's a belt buckle, and it's left an imprint on this person's arm as shown. Another very classic type of bruise is that of what's referred to as a tramline bruise. And these are bruises that result in parallel margined bruises or similar margin bruises, where you have between the two lines of bruising an area of tissue sparing. The bruises result from damage to the vessels occurring as a result of compression of the tissue at the edges where the object has been used to hit the individual and cause the bruising. There are a number of things that will affect the appearance of a bruise. Apart from having distinct features, bruises can be altered in how they appear by a whole series of different situations. For instance, the laxity of the subcutaneous elements under where the person may have been hit. For instance, palms versus lax tissues. For instance, in the case of palm, you often difficult to see any bruising at all, whereas in the lax tissues it's more evident. If there's underlying bone too, that increases the likelihood of a bruise, whereas if you're hit in an area such as the abdomen where there's no underlying bone, it's less likely that you'll see a bruise. This doesn't mean to say that a bruise won't occur at that site, but it's less likely to occur there. Infants and the elderly tend to bruise more easily. It's very difficult at times, particularly in people with darker skin colours, to be able to see bruising, although bruising still does occur. The force of impact, of course, may also affect the appearance of a bruise. However, it needs to be kept in mind that force of impact is not necessarily going to dictate exactly how a bruise is going to appear, and more of that in a moment. There are various medical conditions too that affect how a bruise may look, and these include bleeding disorders, conditions such as chronic alcoholism and hypertension. Some medications such as steroids also affect how a bruise will look. And then there's the entire issue of delayed presentation. You may have a bruise in a deep plane, or anatomical plane of the body, and a classic site for this to occur is in the thigh, and you'll sustain the injury on one particular day, but it may take several days for that bruise to actually reach the surface and be visible. Treatment, of course, also affects how a bruise will look, and ice or drainage of the area will affect how the bruise appears. Here are some examples of further bruises. This is one showing the subconjunctival hemorrhage of or subconjunctiva of a person showing a bruise affecting their eye due to forceful pressure, such as an object being poked into this person's eye. In this case, shown here, this lady sustained a blow to her forehead, and with time that bruise moved down into the softer tissues around her eye and her jaw, giving the appearance of bruising in that location. And although there's bruising in that location, the injury wasn't actually to those locations, it was to her forehead. So bruises can migrate. Just to give you some examples of some other bruises, fingerprint bruises, which become reasonably important, particularly in cases of child abuse. And you can see an example of a fingerprint bruise in this photograph. And then there are the other types of bruises that may not necessarily be associated with an assault or injury as such. In this photograph, we can see what is referred to as a hickey or love bite. But of course, bites are not always associated with love and affection, but can be actually quite aggressive, as shown in this photograph. Often we're asked about the age of a bruise. Despite all the research that's been done, there's very limited amount of information regarding the age of a bruise. And basically, if a bruise has a yellow border, then it's 18 hours or older. Bruises that are red, blue, purple could be of any age. A red appearance of a bruise has absolutely no bearing on the age, and a bruise of identical age on different parts of the body may all change at different rates with time. An example in this photograph is of a bruise that's at least 18 to 24 hours old, and you can see the yellow discoloration associated with the bruise. That's a very brief overview of bruises. Before I finish, I'd like to acknowledge that the photographs utilised in this presentation are from a small book produced by 3 colleagues of mine and myself called Forensic Medicine Colour Guide. If you have any comments that you wish to make, please do so in the space below, including any suggestions for future topics. Alternatively, you can write to me, John Gall, at info@erahealth.com.au. Until the next time.